We are Group 9. We are going to be going over Hindu culture, and I'm Brandon, and I'm going to be doing ethical considerations.
I am Jessica, and I will be talking about the nursing implication portion of this.
And I am Daniel, and I will be dealing with specific aspects of the culture.
Okay, so the significance of a new birth to the culture of Hinduism basically goes to say Hinduism is India's oldest religion. It encompasses family traditions, beliefs, and practices. Basically, it's based on the pursuit of truth and higher consciousness with ultimate and uniting the individual soul and God. So, with that being said, to people who practice Hinduism, karma is very important to them and it ties into a birth of a child. They believe that every action in this lifetime that is carried on into the next. So, child conception is a very sacred event to them. Throughout the pregnancy, prayers are said, and once the child is born, the name is based on a star. So, what that means is it's calculated by the position of the child and the moon at the time of birth. This will sometimes delay parents' ability to pick a name while in the hospital. A lot of times, the birth certificate will not be completed until after discharge. These mothers also prefer to breastfeed over using formula, and circumcisions is not really practiced in Hinduism. So these details are very important for nurses to know and have those considerations and respect the culture of Hinduism. Next, I want to talk about death and how that applies to nurses, doctors, healthcare providers when caring for patients that practice Hinduism. Family must be kept fully informed of the illness and its progression, especially if death is very close to happening. The reason behind this is because special prayers must be said. The doctor must recognize the concept of karma and reincarnation, as mentioned earlier. These principles are very important to this culture. After a patient dies, certain rituals are to be carried out. The family will be distressed if this doesn't happen. So, again, it goes back to the healthcare team communicating with the family. The family is very concerned about the well being of their relative's soul and the consequences for themselves. This all goes back to karma. A priest may be called to pray. The priest will adorn the person's head with what they call sandalwood paste, holy ash, and kumkum powder. A red or yellow string may be tied around the wrists. Family will be the ones to wash the body, close the eyes, and straighten the legs. So, again, the nurses, healthcare providers, and the staff need to be respectful of that. The hospital staff will also need to make space and resources available for the family, whatever they might need. A death also needs to be registered as soon as possible because this culture believes that the body should be cremated in 24 hours. Okay. So now let's talk about family structure. Family is very, very important to all cultures, but it's especially important to people who practice Hinduism. Many generations live under one roof. Traditionally, the male will be the provider and the protector of the home. The female will be in charge of the home and the family. Mothers are very sacred and treated with respect. In matters of diagnosis, treatment, or consents, the patient's relatives must be present. They will play an active role in the decision making with the patient. As healthcare providers, we must ensure the individual patient's wishes are respected. Next, I want to talk about how to provide culturally competent care with patients who practice Hinduism. Being culturally competent and sensitive to patients' needs will improve their outcomes and compliance. Hindus respect the medical profession, but they are very skeptical when it comes to medications. Giving these patients detailed explanations of why certain medicines are prescribed is very important. As mentioned earlier, if they understand why a certain medication is needed, they will be more likely to comply with the plan of care. Going into more of a detail with being culturally competent, we need to touch base on the diet. So, Hindus are vegetarians as an indication of their spirituality. Eating meat would mean taking the life of another living thing. That living thing contains the life of God and thus harming God's soul. This ultimately will harm their own soul. This comes into play with Hindu patients and the use of insulin. Many Hindu patients may not take insulin that is made from animals. In these cases, as detailed explanation of the contents need to be explained to these patients. With the proper explanation and providing the patient with insulin that is not made from animals, the patient will be more likely to comply with the insulin regimen. Also very important to understand what illness means to patients who. There are a few other considerations to take into play when it comes to these patients, especially what will they wear when they're in a hospital. Some Hindu women prefer to wear their sari. This is our sari. This is a very traditional to this culture. The gowns that we use in the hospital are usually open to the back, and this could be offensive to these women. So a nurse can also place another gown behind these patients if they don't have their traditional sari available, just to show respect for them. Hindu women are also reluctant to get undressed in front of a male doctor, and they will ask to be examined by a female doctor. So we can only try our best to make that happen. Next, I want to talk about how to provide culturally competent care with patients who practice Hinduism. Being culturally competent and sensitive to patients' needs will improve their outcomes and compliance. Hindus respect the medical profession, but they are very skeptical when it comes to medications. Giving these patients detailed explanations of why certain medicines are prescribed is very important. As mentioned earlier, if they understand why a certain medication is needed, they will be more likely to comply with the plan of care. And last but not least, just touching base again on the importance of family. So family is very important to include when it comes to education and health matters. More or less, I'm going to talk about the health promotion with these patients from a nurse's standpoint. Patients with chronic conditions will have to have a clear understanding of how to keep their illness from progressing. The nurse's job is to make sure that the patient and their families have the right tools to ensure health promotion is taking place upon discharge from the hospital. The family is needed because Hindu patients need reassurance that what they are doing to their bodies is okay. And this special reassurance comes with the reinforcements from their families and their families' opinions. The nurse must understand how physically active the patient can be. If there are barriers to the physical activities, alternative options will be talked about. They must also ensure that the patient will be able to carry out the alternative actions. Rest is very important. We know that the female role is to take care of the family at home. These patients must not forget to take care of themselves as well. If their health is not what it should be, the family should be able to help with that. Taking time for themselves benefits not only them, but their families as well. Nutritional needs also need to be discussed because Hindu patients have a vegetarian-based diet. The nurse must make sure that they are getting all the nutrients that they need on a daily basis. Other sources of proteins will be discussed. Lastly, with these patients, there is a language barrier. We do not want this language barrier to negatively affect the quality of health care they will receive. It would be a good idea to set these patients up with a primary care provider that is of the same culture and religious practices. This is possible. The case managers on the unit can provide the family with a list of providers in this category.
Today I'm going to be talking about Hindu spirituality. Hinduism is one of the world's largest known, oldest religions. Hinduism can be tracked back to between 5,000 and 10,000 BC. It's the third largest religion in the world with more than 1 billion followers. Hinduism originated in India and is largely based on teaching from the Vedas. Hindus believe in a god named Brahman, but view other gods and goddesses as manifestations of him. Therefore, in practice, they worship more than one god. Most Hindus worship God in the form of an idol: rivers, mountains, trees, animals, and natural things which are useful for a human being. are revered as Hinduism. Cow is the most revered animal for Hindus. Main deities: Lord Brahma, Lord Vishnu, and Lord Shiva are the creator, protector, and destroyer, respectively. Besides them, Lord Ganesh, Lord Krishna, Lord Hanuman, Lord Rama, and Goddess Parvati are the most popular deities in Hinduism. The ultimate goal of a Hindu's life is salvation. Hindus believe in 4 stages of life: Brahmacharya, which is the student phase; Grihastha Shram, living with wife and children; Vanprastha Ashram, leaving the home and praying to God, keeping contact with family; and Sannyasaram, which is discarding everything in life and including your wife, children, and material things. Contributions from Hinduism include yoga, pranayama, meditation, Ayurveda, vegetarianism, and meditation are the best gifts, of Hinduism to the world. They also gave help towards palmistry, acupuncture, martial arts, and tantric sex. Hindu philosophy includes, what is karma? Karma is your deeds. Hindus believe that your fate depends upon your karma, i.e., you reap what you sow. If you do bad karma, you have to compensate for it as in this life as well as in the next life. Your next life depends on karma, how well you do in this one. Reincarnation. Reincarnation is when a soul dwells in every living thing, and the body is just a mortal instrument, but the soul is immortal. So when we die, our soul enters a new body, and the cycle continues until we obtain salvation. Hindu dietary practices can vary depending on individual beliefs and customs. Most Hindus do not eat beef or pork, and many follow a vegetarian diet. Fasting is common among Hindus, but there are no set rules, and the decision to fast is up to the individual. Many Hindus follow Ayurvedic dietary practices. Under this system, certain foods are classified as hot or cold and can be adversely or positively affect health conditions and emotions. The classification of foods as hot or cold is unrelated to temperature. Hot foods are generally those foods which are salty, sour, and high in animal protein, while cold foods are generally sweet or bitter. Some strict Hindus do not consume garlic or onion, as the properties of these foods disturb spiritual practices such as meditation. Hindu death rituals. Hindus believe that the time of death is determined by one's destiny and accept death and illness as part of life. As a result, treatment is not required for a Hindu patient if it merely prolongs the final stages of life of a terminal illness. Under those circumstances, it is permitted to disconnect life support systems. However, suicide and euthanasia are forbidden in Hinduism. When it comes to the preparation of a body that has passed, close family members usually wash a deceased Hindu's body, with the eldest son taking a leading role. The family may wish to light a small lamp or burn incense near the body, and if possible, all jewelry, sacred threads, and religious objects should be left in place. Healthcare providers should advise family members if it is necessary to remove these items. The deceased patient's family may have a preference for the position of the body after death, and Hindus are usually cremated as soon as possible after death. Location of Hindu. Most Hindus live in India, Nepal, and Sri Lanka, with considerable presence in all other parts of the world. About 85% of Hindus live in India. Hinduism originated in India and is largely based on the teachings from Vedas. Common diseases when it comes to Hindu um, culture. Chronic diseases include cardiovascular and respiratory diseases, mental disorders, diabetes, and cancers, and injuries are the leading causes of death and disability in India. The 13 common communicable diseases found in India are malaria, typhoid, hepatitis, jaundice, leptospirosis, diarrheal diseases, amoebiasis, cholera, brucellosis, hookworm infection, influenza, filariasis, and tuberculosis.
Okay, now we're going to discuss conduct and character as related to Hindu culture. Um, the Hindu believe that behaviors, actions, and conduct all come from will, and that character can be perceived as individuality. But as far as actions, negative actions, they really don't really believe in being judgmental. So a person's external behavior isn't always a good judge of their character. If they're doing things negatively, they could actually have a good character. So they don't want you to jump the gun and judge people and their culture. All right, and we're going to talk about ethics as a part of spirituality and religion. The Hindu believe that ethics and religion go hand in hand, that you can't go onto the spiritual path without having good ethics, and to strive towards ethical perfection is a really big thing as far as spiritual progress and striving to do well, striving to do good unto others, and to make it a good vision, to make it a realization, is something that's very important in their religion. We're going to talk about the benefits of the practice of ethics in Hindu religion. Um, as I stated earlier, the Hindu really believe in spirituality and ethics tying hand in hand. Um, they believe that that morality is the gateway to religion, and leading a virtuous life, leading a righteous life, one will attain freedom, and to practice harmony with your neighbors, with your friends, with your family members, with strangers, fellow human beings. You you will have lasting happiness in your soul. They believe that it will purify your heart, and also to be truthful is a very important thing when it comes to the benefits of practicing ethics. Good conduct is the root of spiritual prosperity, and conduct increases fame. But they also believe it prolongs your life and destroys all evils and will bring you in eternal happiness. And that's it on that. We're going to talk about the foundational principles of Hindu ethics. Um, some of the main things are do not kill, do not injure others. That's very important. As I stated earlier, loving your neighbor, loving your family, loving your friends, respecting your family, respecting your friends, respecting strangers, and this is kind of like a universal brotherhood to unify everyone. They're really big on unity, and they believe that ethics is the foundation to all of this. Ethics is very important in their religion. Um, these are very important things in their religion. All right, so we're going to talk about service as a worship in Hinduism. They do believe in practicing what you preach. Um, they definitely want you to live your life being charitable. This is very noble in their religion. Um, being giving. Just take for instance, if you see someone that's hungry on the street, or someone that needs a favor to go ahead and do that for them. It's very common for them to take someone into their own home and feed them and give them clothing and bathe them if they're, take for instance, homeless. Um, this is very virtuous for them. And it goes into everything that I was saying earlier about being righteous and practicing what you preach. So their service as a worship is something that's very, very important. All right, so another big thing with Hindu culture and ethics is the process of purification. Um, doing good is supposed to, doing good deeds is supposed to mentally purify um, the individual. It is supposed to remove all evil from their little personal bubble. Um, uh, the process of mental purification um, can it can include egoism, you know, having a lot of pride. That's relieving yourself of pride, relieving yourself of having a big ego is something that leads the individual towards purification. And this is something that they want, because you have to remember they believe in all the deeds that are done in one life is passed on to the next life. So doing good deeds in one life is going to be passed over into the next life. And the same thing with karma. Doing bad things is going to possibly lead over into the next life. So purification with them, doing good deeds, removing themselves of their egos, removing themselves of pride, really helps them get towards that. Having evil thoughts and things like that, it's something that they try to refrain from doing. So the further away from the negative things that they get, the closer that they actually believe that they are to purification and to having happiness in their next life and their current lives also. So the Hindu philosophy on right and wrong is something that they live by. This is something that we've talked about this entire presentation. Um, the philosophy of right and wrong with them, good and bad, is basically their law. They live on not doing things that are bad and doing things that are good, living a life of righteousness. This is something that's very common. Um, good and bad, right and wrong. This is a law for them, and they try to stay on the good side, as in most religions. So one thing, the last but not least, we're going to talk about yoga gardening, which is very big in the Hindu religion. Um, Yoga gardening, basically, the concept of that is to plant good seeds in your heart that are going to grow into flowers and beautiful plants and whatnot. Um, all good deeds are going to be considered good seeds. They're going to be considered seeds that are going to turn into beautiful plants and flowers and such. Evil deeds, bad deeds, things like that are considered to grow weeds and bushes and stuff that you don't really want in your garden. So if you think about a garden, a pretty garden, um, as far as Hindu religion is concerned, a pretty garden would be a garden full of nice flowers, and all those flowers would represent good deeds that the person did throughout their life. It would represent, nice things that they've done. It would represent them not being egotistical, represent them not being very prideful, and if it was a bad garden, it's just basically you reap what you sow, karma. But but this is reflecting into your garden. So if you had a bad life full of negative things, and your garden is going to look pretty crummy. If you had a good life and you helped people and you did everything as far as good standing with this religion, as far as that's concerned, then you're going to have a really pretty garden.